AB680 is an investigational small molecule that is a selective and potent inhibitor of CD73. CD73 is the primary enzyme that produces extracellular adenosine within the tumor microenvironment. And we know that increased expression of CD73 has been associated with poor prognosis in several cancers, including metastatic pancreas cancer. So AB680 has been recently renamed Quemliclustat, and it has been shown to decrease production of adenosine in preclinical models, and hence is thought to decrease the immunosuppressive function of adenosine in hopes to restore immune-mediated neoplastic cell death. So since increased CD73 expression is associated with poor prognosis, presumably due to higher levels of extracellular adenosine, and that adenosine shuts down the generation of adaptive immune response to immunogenic cell death, the hypothesis is that targeting CD73 will decrease adenosine-mediated immunosuppression. And although the addition of anti-PD-1 therapy to standard chemotherapy has not really resulted in improved outcomes in metastatic pancreas cancer, in contrast to other malignancies, the hypothesis here is that the addition of CD73 inhibition will lower the immunosuppression threshold, allowing anti-PD-1 treatment to function in concert with chemotherapy. So ARC-8 was designed to evaluate the safety and preliminary efficacy of Quemliclustat in combination with gemcitabine and nab-paclitaxel, with or without Zimberelimab, an investigational anti-PD-1 antibody. Safety results from all 122 patients who received 100 milligrams of AB680 plus chemotherapy with or without anti-PD-1 identified no new safety signals, and the most common grade 3 or higher adverse events were neutropenia and anemia. There were 5 deaths that were reported on the study. However, none of them were thought to be related to the investigational agents. The overall response rate for the 93 patients who received 100 milligrams of AB680, Zimberelimab, and chemotherapy was 38%. With the caveat of cross-trial comparisons, the response rate is in line to that observed in current clinical trials with gemcitabine and nab-paclitaxel. However, of note was that the median overall survival of the entire 122 patient cohort was 15.7 months. While that for the 93 patients who received Quemliclustat with Zimberelimab, gemcitabine, and nab-paclitaxel was 13.9 months. Since ARC-8 did not have a chemotherapy control arm and to evaluate the results of the study in context of chemotherapy benchmarks, an analysis was performed with a synthetic control arm of patients who were treated with gemcitabine and nab-paclitaxel in other phase 2 and phase 3 clinical trials in first-line metastatic pancreas cancer. The median overall survival within this post-hoc synthetic match control arm was 9.8 months, which is obviously numerically lower than the 15.7 months observed in the 122 patient cohort who received AB680 with chemotherapy with or without anti-PD-1. Pancreas Biosciences, the sponsor of this study, plans to initiate a registrational phase 3 study to evaluate Quemliclustat with gemcitabine and nab-paclitaxel versus the standard of care arm, which is gemcitabine and nab-paclitaxel alone, as an initial treatment of patients with previously untreated metastatic pancreas cancer. The current plan is that the study is expected to start enrolling patients either later this year in 2024 or early in 2025.